Feeding your heart warrior. We found out that Millie had a heart condition while I was still pregnant, and at that time I was determined to do anything I could to help her be that much stronger. So I wanted to have a natural childbirth, I wanted to breastfeed, and I wanted to do as much skin to skin as possible. When Millie was born, she went on neck watch. Neck is when there is not enough blood flow to the bowels, and it can cause damage if you feed the child. So she wasn't allowed to eat for the first 2 weeks of her life. I started pumping right away, and I was really disappointed that Millie couldn't have my breast milk. But some of the nurses were willing to use it when they did mouth care, so she would get a little tiny bit in her mouth to help clean it out. When we were allowed to feed her, we had to do it really slowly. We started with 1 ml of milk, and then every 12 hours they would increase it by 1 ml. Derek and I were so excited to get the opportunity to feed her that we would rush to the hospital every 3 hours to give her 1 ml in a syringe. Cardiac babies often have feeding issues because their heart's working so hard. So not only do they have issues with the actual sucking motion, but they also have trouble eating enough calories to gain weight because they're burning it off so quickly. I pumped religiously every 2 to 3 hours to make sure there was a stock of milk ready for Millie when she was allowed to eat. And I would do a lot of skin-to-skin contact to help my milk come in, holding her close to me. When the palliative care team became involved in Millie's care, they asked what was an experience I wanted to have, and I said I'd like to breastfeed Millie. They arranged so I could try breastfeeding, and Millie latched to everybody's surprise. After that, I was there every 3 hours. We would pre-weigh Millie and then weigh her after to see how much milk she drank. And then we would top her up with breast milk through an NG tube. Everyone seemed to think it was a miracle that a child as sick as Millie was able to breastfeed and still gain weight. When it became time for us to go home, the doctors started talking about something called a G tube, which is a tube that goes directly into your child's stomach that you can feed them. I did not want to go home with a G tube. I was sure Millie could do it. So at that time, we worked a lot with occupational therapy, and we switched from breastfeeding to bottle feeding. Every 3 hours, Derek and I would offer Millie a bottle. We would sing and coach her and do every trick that we were taught to try and get her to take a decent volume. And then at the end of 20 minutes, we would gravity feed the rest of her feed into her tummy. And we would start again 3 hours from when we started. Millie managed to prove to the doctors that she didn't need a G-tube, but we did go home with an NG tube. So Derek had to learn how to put the tube in to her stomach, and we learned how to gravity feed her. This was a really hard time because Millie would throw up a lot. If you put too much in, we were trying to get her to gain weight. If you did it too close to the evening, if you moved her while the feed was running. So she spent a lot of time in her swing with her NG tube gravity feeding from taped to the top of it. And we just kept working with her and dealing with lots of spit ups and weight gains and then weight losses. Her nose would get really stuffed up from having the tube down it, and her throat would get sore. We'd have to use one of those suction balls to suck all of the boogies out of her nose so that she could breathe. The NG tube would leave pressure wounds on her cheeks, and it had to be taped really good, or Millie would pull it out, and then we'd have to put it back in, and it was awful. We'd have to check it every time we used it to make sure that it was still placed within her stomach, because if it was too high, then we could put the food into her lungs and essentially drown her. And then one day at one point, Millie just pulled her NG tube out, and I felt so bad putting it back in that evening that I just left it out and let her drink what she wanted from her bottle and put her to bed. The next morning she woke up and drank, and she didn't need it anymore. And then after her next surgery, she did. but she also began eating more solid foods. We started introducing things like bananas and mesh feeders, scrambled eggs, cereal, avocados, and yogurt, and she just loved it all. And she started to grow, finally, all on her own, and eat everything in sight. Millie, are you having eggs for breakfast? Are they yummy, baby girl? You're not supposed to eat the bowl, you eat the food. I know, it's a novel concept. We spend a lot of time making sure that Millie has positive perceptions of food and eating. She loves to cook with us. She gets to taste everything and help us put it in bowls and mix. In our family, food is family time. So there's always food around, and it's something that we do often, and Millie seems to fit right in. She loves to eat raw vegetables. They've helped with her teething. Cucumbers and broccoli, anything with a texture feels really good on her teeth. She likes to get messy and feed herself. She's very independent. She has great fine motor skills, and she uses her forks and her spoons all by herself. You feeding yourself homemade stew, Millie Grace? Did your daddy make you stew? Is it good? She loves Mum-Mums, although I try not to give them to her too much because they're very low calorie, and we're always trying to fatten her up. She always surprises the doctors with how much she's willing to eat after surgery. Sometimes it's a chore after she's been intubated to get her to be willing to swallow and drink because her throat's sore, but we always work with her so that she doesn't get oral aversions. She recently graduated to using a sippy cup, which is huge for a heart baby. They were pretty impressed in the hospital that Millie's capable of drinking and sucking from one. She likes to eat breakfast in her high chair with Mom and Dad. Derek likes to cook big breakfasts, and she sits in her high chair every morning, and he feeds her and plays with her and talks to her while he gets ready for work. And look at how big she's getting. I continued to breastfeed Millie, or ensure that she got breast milk for the first year of her life. I'd comfort breastfeed at night, but for the most part she took from a bottle. And then on her first birthday, it was time for me to stop. Celebratory beer. Right now, Millie eats everything. She loves to go to restaurants because they give her crayons, and she gets food from the children's menu, and sits in the high chair with Mom and Dad, and she likes to look at all the people go by. She drinks whole milk and eats lots of crackers and veggies, and she just loves to eat. Our last trip to Toronto, she was diagnosed with a bone disorder, which can happen to kids who have spent a lot of time in hospital and in cribs. So she now gets some formula that's high calcium and has other things that she needs at night. But during the day, she can eat what she wants and still drink her whole milk. I think her favorite food is chicken nuggets from McDonald's, which she gets as a special treat when we have IWK appointments. I feel so blessed that with all the challenges that we've had, feeding has not been one of them with Millie. That she is willing to eat and that she is willing to grow. And in December, we were told that she was the perfect weight for her height, and that was so exciting for us. Then we had 2 cath procedures and a bout of kidney stones, and she's lost a lot of weight. So we're back to working on feeding Millie again. But we know we'll get there as soon as she is feeling better, gets that tube out. The first thing she's getting is some ice cream and oatmeal cookies. Good job. Good clapping. We're excited to go. Oh, and kissing. Kiss your doggies goodbye.